السلام عليكم طلاب، راح نبدي وياكم محاضرات الكارديوفاسكولار سيستم باثولوجي for this week. The subject is hemodynamic disturbance. Edema defined as increased fluid in the interstitial tissue spaces. Normally about 60% of body weight is water, with 2/3 of it intracellular and the rest in the extracellular compartment, mostly as interstitial fluid, and only 5% of total body water is present in the blood as plasma. So by definition, edema mean increase in the fluid, not blood, in the interstitial tissue, mean in the extracellular tissue, so not in the intracellular, not inside the blood vessels. According to the site, we have different names like hydrothorax mean edema in the pleural space, hydropericardium mean in the pericardial space, ascites in the peritoneal space. Anesarca refers to severe and generalized edema with a profound subcutaneous tissue swelling. Edema fluid divided into two types according to the protein component and therefore specific gravity into transudate, which is protein poor, and exudate, which is protein rich, and each type of edema occur in specific situations. This is the clinical examination of edema by producing pressure by the finger on the interior aspect of the leg, reveal pit حفرة remaining for a few seconds and disappear. Normally there is a compensatory mechanisms in the body that prevent edema formation. We have two forces at the capillary bed which is usually equal under normal situations. This is the schematic representation of the capillary bed. This is the capillary, this is the arteriolar end, and this is the venous end. Normally, under normal condition, there is a continuous filtration of fluid from the inside capillary into the interstitium. This interstitium has a background, a white background is an interstitium. So by this force there is a filtration and then reabsorption by this an opposite force that move fluid from the interstitium into the capillary. So this equal the filtration equal to the resorption. In addition, excessive fluid usually removed by lymphatic system through the lymphatic vessels. So there is no edema formation in normal condition. So pathophysiology of edema. This is the capillary, and we have two force. This is the hydrostatic pressure that move fluid from inside the capillary into the interstitium in this direction. This is the colloid osmotic pressure that move fluid from the interstitium, the background, into inside the capillary, called colloid osmotic pressure. And excess fluid removed by lymphatic channel into the lymphatic system. Normally, as we mentioned previously, normally this pressure equal to this pressure. So how edema develops? Edema develops when there is an increase in hydrostatic pressure or decrease in colloid osmotic pressure. فهنا من decrease in hydrostatic pressure معناها هذه الفورس تزداد، معناها ال direction of movement يزداد باتجاه ال interstitial tissue space. While when there is a decrease in colloid osmotic pressure معناها هذه القوة راح تقل. هذه القوة اللي هي تدفع الفلويد from the interstitium into the capillary. من تقل هذه القوة معناها الفلويد راح يتجمع بالinterstitium resulting in edema. The third cause of edema when there is a lymphatic obstruction by any cause, so the fluid will accumulate and there is no drainage into the lymphatic system. So the pathophysiological categories of edema: increase in hydrostatic pressure occur in such situation, decrease in plasma oncotic pressure. Protein component of the plasma responsible for plasma oncotic pressure. When there is decrease in the plasma protein component of the plasma, there is decrease in the plasma oncotic pressure. In cases of hypoproteinemia of any causes, for example, in renal problem where there is excessive loss of protein in urine, and liver cirrhosis because the liver is responsible for protein synthesis in the body. So when there is a liver failure or cirrhosis, there is a decrease in the protein synthesis and resulting in the decrease in the plasma oncotic pressure and therefore edema formation. And malnutrition when there is low protein intake in the diet and protein losing enteropathy through the intestine where there is an excessive protein loss. Lymphatic obstruction, the third cause of edema, as in inflammation, neoplasia, post-surgical or post-irradiation. Sometimes post-surgical mean there is a fibrosis after surgery causing blockage and obstruction, and post-irradiation also fibrosis. Fourth cause is sodium retention and in excessive salt intake and renal insufficiency. As a biochemical rule, each كل ذرة صوديوم راح تسحب وياها water associated with an obligate resorption of water, so resulting in the increase in edema formation. Increase in vascular permeability as characteristically occurred in inflammation and the resulting edema called exudate, which is a protein rich. Microscopically, edema fluid generally manifest as swelling with the cleaving and separation of the extracellular matrix components. هنا normal skin احنا اخذنا skin for example skin dermal edema. هنا the normal skin histology is composed of an superficial layer of epidermis and an underlying layer of dermis. This is in case of dermal edema, there is a separation between extracellular matrix component and collagen fiber in the derm. So this manifests as whitish color. Hyperemia and congestion. Hyperemia means local increase in the volume of the blood in a particular tissue that results from augmented blood flow due to arterial dilatation and is an active process like in inflammation, skeletal muscle during exercise. While congestion means a local increase in blood volume in particular tissue that results from impaired venous return from a tissue, which is a passive process that may occur systemically as in cardiac failure, or it may be local due to venous obstruction. هنا نشوف الفرق بين hyperemia and congestion. Both mean a local increase in blood in volume of the blood, but the cause of hyperemia from augmented blood flow, so it's an active process, while congestion is the cause of congestion impaired venous return, so it's a passive process. راح ناخذ two organ commonly present as a congestion in congestive heart failure. First organ, lung, and second, liver. The lung, we have acute pulmonary congestion and chronic pulmonary congestion. In acute pulmonary congestion, there may be engorged alveolar capillaries with an increased septal edema, associated septal edema, focal minute intra-alveolar hemorrhage. While in chronic pulmonary congestion, in addition to the changes seen in acute congestion, the alveolar septa become thickened and fibrotic. The alveolar space may contain numerous hemosiderin-laden macrophage. This is the histological picture of lung in pulmonary congestion. This is it's composed of alveoli. This is the alveoli, and this is the alveoli, and this is alveolar. Back to back alveolus, and this is the alveolar septa اللي هو يفصل بين كل alveola and الثانية حويصل هوائية عن الأخرى تفصلها. alveolar septa contain blood vessels. So in acute pulmonary congestion there is engorgement of the blood vessel dilated. تشوفوا هسه هاي blood vessels dilated and filled with the blood, congested, engorged, filled with the blood, and there is mean a small amount intra-alveolar hemorrhage, and this is transudate, this is an edema inside the alveoli. While in chronic pulmonary congestion, in addition to the changes seen in acute pulmonary congestion, there is fibrosis of the alveolar septa. هنا حيكون fibrosis, and there is hemosiderin laden macrophage. Characteristically هذه الهيموسيدرين laden macrophage تسمى heart failure cell. اسمها heart failure cell، لكن هي ما تحدث بالهارت، هي تحدث بالchronic pulmonary congestion. So what is heart failure cell? It's a hemosiderin laden macrophage inside the alveoli in cases of the chronic pulmonary congestion. لو نعيد هنا الفرق بين acute والchronic pulmonary congestion highlighted by yellow color: thickened and fibrotic alveolar septa and heart failure cell. قلنا ان هي تسمى heart failure cell لانه عادة congestion of chronic pulmonary congestion occurred in congestive heart failure. Second organ, chronic passive congestion of the liver. A grossly mean naked eye examination, liver is enlarged in thin in consistency, cut surface show mottled appearance، راح يكون منقط، dark area that contrasts with pale peripheral periportal area giving an appearance similar to the cut surface of nutmeg, so called nutmeg liver. هذه gross examination mean macroscopic examination by naked eye examination, and this is the microscopic examination by light microscope. grossly the liver يكون منقط، كنا nutmeg liver، نقاط dark red alternating with peripheral light yellow area، فتكون شكله منقط. هذا grossly. microscopically liver, the building unit of the liver, it's a hexagonal structure. In the center there is a central vein, and in the periphery there is a portal tract, each central vein surrounded by 6 portal tracts. In the chronic passive congestion of the liver, there is هذه central vein راح يكون in area immediately adjacent to central vein there is a hemorrhage with necrosis caused by pressure effect. هذا ال pressure may يجي from dilatation of the central vein and congestion filled with blood. So there is a pericentral vein hemorrhage responsible for the dark color, and periportal هذه portal tract periportal, there is a periportal preservation or even mild injury like fatty changes, mild irreversible injury, fatty changes responsible for the light yellow color. فعندنا هنا راح أعيدها. central vein usually dilated and engorged with in the area immediately adjacent to central vein there is a hemorrhage. The portal tract, the area immediately adjacent to portal tract usually preserved, normal, or undergo mild injury or fatty changes. Hemorrhage generally indicate extravasation of a blood due to rupture of the blood vessels. It may be an external or it may be enclosed within a tissue, so-called hematoma. Clinically, manifestation of the hemorrhage: subcutaneous hemorrhage, petechiae, purpura, and ecchymosis. Petechiae mean minute 1 to 2 mm in hemorrhage into the skin and mucous membrane or serosal surface. They are typically associated with local increase in intravascular pressure or platelet abnormalities and clotting factor deficiency, while purpura, usually larger 3 to 5 mm hemorrhage that may be seen in the same disorder as petechiae, and may be seen in trauma, vasculitis, or increase in vascular fragility, while ecchymosis 1 to 2 cm skin hemorrhage. The RBC are degraded and phagocytosed by macrophages. So the PTK normal usually occurred in condition when there is a clotting factor deficiency, hypercoagulable state, while purpura and ecchymosis commonly due to trauma. In addition to the disorder, clotting disorder also occurred in trauma. This is the PTK, peri-orbital PTK, and this is the ecchymosis, usually larger superficial diffuse hemorrhage on the thigh caused by blunt force trauma, commonly caused by blunt force trauma. عليكم طلاب. الجزء الثاني من محاضرة Hemodynamic disturbance راح ناخذ two subjects, important subject هو embolism and shock. The first subject is embolism, defined as a detached intravascular mass that is carried by blood to a site distant from its point of origin. The mass was maybe solid, liquid or gaseous. هنا عندنا الامبوليزم it's a detached, so it's a circulating moving mass, the most important to decide distance from its point of origin. 99% of all emboli is a part of a thrombi, so the majority usually result from a detached thrombus. However, other causes of the embolism result from the either bone embolism, detached bony fragment, bone marrow emboli. Usually the second and third causes usually occur following fracture of the bone, resulting in the detachment and circulating in the blood to a site distant from its point of origin. Flat emboli also occur in the fracture of long bone, air emboli, atherosclerotic emboli راح ناخدها بالموضوع الاتherosclerosis. Tumor emboli is detachment part of malignant tumor and circulate in the blood. Foreign body emboli such as bullet. الفكرة من هذه إنه the majority of the embolism result from it's a part of thromboemboli. Pulmonary thromboembolism. This means thromboembolism يعني embolism originate from a thrombus, usually present at any point within the pulmonary circulation. 95% of cases the thrombi originate from the emboli originate from thrombi within vein in the lower extremities. So the majority of cases, the origin from thrombus present in the veins of the lower extremities, detached and moved in the circulation and become lodged within at any point within the pulmonary circulation. Maybe in the main pulmonary trunk, maybe across the bifurcation of the pulmonary artery called saddle embolus, or in the main pulmonary artery, or in the medium-sized branches of pulmonary artery, or even in the small peripheral artery and arteriolar branches. This is the gross picture during the post-mortem examination and after death dissection, and reveal the causes of the death was sudden embolus. Sudden embolus means large embolus at the bifurcation main pulmonary tract and its bifurcation causing sudden death. The outcome of pulmonary embolism. You should know that 60 to 80% of all pulmonary embolism are clinically silent because they are small and undergo organization with time and become incorporated into the vascular wall. مثل الفيت of thrombi. one fate of thrombus لما تكون organization مين a growth of the macrophage. هذه الماكروفاج تسوي digestion للثرومبس and recanalization. new canal مثل الثقوب راح تكون inside thrombus هذه responsible for maintenance of the blood flow and prevent obstruction, then so it's pass and become clinically silent, asymptomatic. Sudden death or right ventricular failure pulmonally occurred when 60% or more of the pulmonary circulation is obstructed. This is mean if either large thrombus such as the saddle embolus, large embolus such as saddle embolus, or when 60% or more of the pulmonary circulation is obstructed. Pulmonally mean right-sided ventricular failure secondary to the pulmonary disease, as pulmonary embolism. Pulmonary hemorrhage when obstruction of the medium-sized artery may result in pulmonary hemorrhage. This is due to the blood flow into the area from intact bronchial circulation. لما medium size only pulmonary artery only obstructed, another branches usually remain patent, so resulting in the pulmonary hemorrhage. Pulmonary infarction occurs when small size pulmonary artery or arteriole is occluded, resulting in the infarction, death of pulmonary tissue supplied by that branch, or pulmonary hypertension, Systemic thromboembolism. In 90% of cases, it arises from cardiac mural thrombi. As we mentioned previously, cardiac mural thrombi mean thrombus that occurred or attached to the cardiac chamber. So the origin in majority of cases from the cardiac mural thrombi. The rest of the emboli, represent 20%, may arise from or associated with ulcerated atheromatocyclic or aortic aneurysm. The most common causes هو of systemic thromboembolism هو cardiac mural thrombi. The second other and third other causes هو ulcerated atheromatocyclic or aortic aneurysm. هذه مواضيع راح ناخذها بالمحاضرات القادمة. The major sites for lodging are lower extremity, represent 75%, the brain 10%, and lesser extent intestine, kidney, and spleen. هنا نلاحظ الفرق بين pulmonary embolism و systemic thromboembolism. Pulmonary embolism, the majority of cases resulting from the thrombus in the veins of the lower extremity, while the majority of cases in systemic thromboembolism resulting from the cardiac mural thrombi. هنا pulmonary thromboembolism mean there is an emboli that lodge in at any point within the pulmonary circulation. هنا systemic thromboemboli, any part of the systemic circulation, not pulmonary circulation, systemic circulation. However, the majority in the lodging in the lower extremity. The consequence of systemic embolization depend on معناها الفate or outcome of systemic embolization يعتمد على 3 عوامل. A presence of collateral blood supply. إذا area هي rich in the collateral blood supply عادة يكون ال effect of the systemic embolism أقل من ال area اللي هي blood supply عندها أقل. Tissue vulnerability to ischemia. Some tissue more vulnerable to ischemia than other tissue in the body or other organ in the body. The size of the embolus عادة يتناسب طرديا مع السايز. كلما أكبر كلما produce the more symptoms and be more serious. The second subject is shock. The term shock refers to widespread hypoperfusion of cell and tissue of the body. Hypoperfusion mean perfusion of the blood to that cell, the cell of tissue of the body. Causes of hyperperfusion either decrease in blood volume itself، لأن البلد فوليوم من يقل راح البرفيوجن accordingly أيضا تقل، or decrease in cardiac output، هو منو اللي يضخ البلد لأجزاء الجسم المختلفة هو الهارت، فمن تقل الكاردياك output راح يقل البرفيوجن. شوفون يعني المين باثوفيسيولوجي هو hypoperfusion، راح يقل البرفيوجن of the blood للcell and tissue of the body resulting in shock or redistribution of the blood within the microcirculation causing insufficiency. عادة normally blood distribute in the microcirculation, preventing and usually sufficiently distributed in the microcirculation if there is any factor that cause a redistribution of the blood resulting in shock. فأرجع أكرر المين pathophysiologic mechanism of shock هو hypoperfusion of cell and tissue of the body. There are 5 categories of shock: cardiogenic shock, hypovolemic shock, neurogenic shock, anaphylactic shock. Each categories has an underlying cause or pathophysiology. The cardiogenic shock results from myocardial failure. myocardial failure يقلل الكاردياك output فيقلل الperfusion of blood to the cell and tissue of the body resulting in shock. Hypovolemic shock, which is actually the most common cause of shock, result from loss of blood or plasma volume. من يقلل blood والplasma volume راح يقل perfusion causing hypoperfusion of blood cells and tissue of the body. Neurogenic shock is less common type, occur in anesthetic accidents or spinal cord injury. من اسمها neurogenic spinal cord injury anesthesia due to loss of the vascular tone. vascular tone هو اللي cause distribution of the blood sufficiently tissues and cell and tissue of the body. Mean there is a loss of vascular tone causing a redistribution and insufficient distribution of the blood causing hypoperfusion and causing shock. Anaphylactic shock is a generalized IgE mediated hypersensitivity reaction associated with systemic vasodilatation and increase in vascular permeability. Systemic vasodilatation and increasing vascular permeability result from IgE, mast cell and mediator. This is causing sudden decrease in circulating blood volume and tissue perfusion. هذه اللي ال5 categories of shock. طبعا هي مهمة. كل categories إلها underlying cause، يعني خليتها بالأحمر حتى تحفظوها وتعرفوها. وهذه ال underlying cause كلها تؤدي إلى شنو؟ main underlying pathogenesis. The main underlying pathogenesis of shock اللي هو hypoperfusion of cell and tissue of the body. Now, septic shock, a type of shock, as an important type of shock. It results from vasodilatation and peripheral pooling of blood as part of systemic immune reaction to bacteria or fungal infection. من اسمها septic shock mean there is an infection هذه الانفكشن produce a systemic inflammatory response syndrome لهذه الانفكشن and release of mediators. هذه الميدياترز تسوي لنا vasodilatation and peripheral pooling of the blood. هذه الفيزودايليتيشن بالنهاية ايش راح تسوي؟ راح يقلل لنا البلاد فوليوم، وش راح بعدين تسوي؟ hypoperfusion اللي هي the main underlying pathogenic mechanism of shock. It has a mortality rate of near 20%, and it's considered as the first among the causes of death in an intensive care unit. Currently, septic shock is most frequently triggered by gram-positive bacterial infection, followed by gram-negative bacteria and fungi. Hence, the old name of endotoxic shock is not appropriate. And the term systemic inflammatory response syndrome اللي قلنا هذا ال response of the body to infection. قلنا septic shock هي result from infection from the terms septic. Infection produce a systemic inflammatory response syndrome. من أكو systemic inflammatory response syndrome with a suspected source of infection راح نسمي ال condition termed sepsis. Sepsis mean infection with a systemic inflammatory response syndrome in response to the infection as a body defense mechanism to infection. هذه sepsis with one or more end organ failure is called severe sepsis. فلما تكون infection و systemic inflammatory response syndrome زائد one or more end organ failure راح تكون severe sepsis. Sepsis with hemodynamic instability is called septic shock. فهنا septic shock هي sepsis with hemodynamic instability. لهذا السبب احنا الشوك هي actually shock is an hemodynamic instability. فمن بتكون وياها sepsis the term راح يكون septic shock. هنا السيستميك inflammatory response syndrome هي المسؤولة عن majority of the symptoms of shock. It's a complex pathophysiologic response to an insult. It's an any insult يعني أي مؤثر خارجي. Manifest as an endothelial cell injury and activation. Release of inflammatory mediator اللي هي مسؤولة عن symptoms and pathogenesis of shock, and increase the metabolic rate of tissue, so need more oxygen. نحن microorganism suspected or proven infection فراح يصير diffuse endothelium disruption and impaired microvascular function. Systemic inflammatory response syndrome تعطينا severe sepsis with organ dysfunction. احنا قلنا اذا هذه الحالة انه فقط الانفكشن ويا systemic inflammatory response قلنا the term sepsis، لكن with one or more end organ failure راح تكون severe sepsis or sepsis with hemodynamic instability راح يكون septic shock اللي هي طبعا manifested clinically. هذه only clinical راح تاخذوها بمحاضرات الكلينيكال: hypotension, hypoxemia, oliguria, metabolic acidosis and thrombocytopenia. Stages of shock. You should know that shock is not a static condition, it's a progressive condition. Deterioration of circulation in shock is a progressive, continuous phenomenon and compensatory mechanism become progressively less effective. Normally in the body there is a compensatory mechanism as in edema. Also it's a compensatory mechanism that prevent shock formation. When this compensatory mechanism fail to overcome the condition, resulting in the deterioration of the shock. So we have three stages. The first is a non-progressive initial compensated reversible shock. At this stage, the shock is reversible when rapid action occurred, so resulting in the retention of the normal hemodynamic resulting in the normal hemodynamic state of the body. Progressive is a decompensated shock when compensatory mechanism fail to overcome the condition. Decompensated is irreversible shock. بهذه المرحلة there is an irreversible event and may be fatal. Shock is a syndrome that can occur in the course of many life-threatening traumatic condition or disease states. You should know that it's not a disease itself. It's a syndrome that occurs as a complication of many disease, many traumatic condition, many disease states, as a complication producing an hemodynamic instability and shock. هنا stages of shock مثل ما as mentioned previously. Initial non-progressive stage is a compensated stage when compensatory mechanism work during which reflex compensatory mechanism are activated and perfusion to vital organ is maintained. هذه اللي many neurohormonal mechanism operate اللي راح تاخذوها أو بالفسلجة. It's a normal compensatory mechanism to prevent shock formation. Progressive shock هذه stage when it's a decompensated, when the compensatory mechanism is still act and overcome, so characterized by anaerobic glycolysis switch inside the cell from the aerobic to anaerobic glycolysis because of hypoxia. Hypoxia results from hypoperfusion of the blood. Lactic acidosis increase in the production of lactic acid and lowering of the pH inside the cell. Irreversible stage in which there is widespread irreversible cell injury and even correction of the hemodynamic disturbance will not stop, and deterioration of the cardiac output and metabolic acidosis. The reduction of the blood flow to vital organs such as brain, heart leads to ischemic necrosis and cell death. The cellular and tissue effects of shock are essentially those of hypoxic injury. Hypoxic injury. Why hypoxic injury? لأنه احنا قلنا the main underlying pathologic mechanism of shock هو الهايبوبرفيوجن. blood hypoperfusion لأنه من يقل البرفيوجن راح يقل الأكسجين supply to the tissue and cell of the body resulting in the hypoxic injury. لأنه عندنا many type of cellular injury من ضمنها type hypoxic injury occur in shock and are caused by combination of hypoperfusion and microvascular thrombosis. من يكون small thrombi within the microcirculation prevent flowing of the blood sufficiently to tissue and cell of the body resulting in the hypoxic injury. Decrease in the oxygen supply of the blood to the cell and tissue of the body. Although any organ can be affected, brain, heart, kidney, adrenal and gastrointestinal tract are most commonly affected. Except for neuronal and cardiomyocyte loss, affected tissue can recover completely if the patient survive. After survival of the patient, usually recover effect of shock on any organ can recover completely except when there is an injury to the neuron or cardiomyocyte. Thank you with best wishes. Thrombosis is defined as the formation of a solid or semi-solid mass from the constituents of blood within the vascular system during life. So, from definition, formation of solid or semi-solid mass usually has a constituent similar or from the constituent of the blood inside the vasculature and during life, not after death. Pathogenesis, we have Virchow triangle or trade consists of endothelial injury, stasis or turbulence of blood flow, and blood hypercoagulability. Damage to the vascular endothelium may result from either mechanical injury or degeneration of the vascular endothelium or inflammatory process as vasculitis. Slowing and stasis of blood flow cause either disrupt laminar flow and bring a platelet in contact with endothelium, leading to the activation normally laminar flow that prevent platelets in become contact with the endothelium. So any disturbance in the laminar flow result in thrombosis, prevent dilution of activated clotting factor, and prevent a flow of coagulation inhibitors and permit the building up of thrombi. Hypercoagulability, defined as any alteration in the coagulation pathway that predisposes to thrombosis, either primary inherited cause or secondary acquired cause. Appearance and composition of a thrombi. Pale thrombus formed in rapidly flowing blood artery, usually platelet rich. Red thrombus stasis formed in stagnated blood. It's dark red and gelatinous. They tend to contain more enmeshed RBC. So it's RBC rich. So from the name, pale, usually platelet rich in the artery, and red, usually RBC rich. So it's dark red and form in stagnant blood. Stagnated blood يعني الركود. Mixed thrombi formed in slowly flowing blood has a laminated appearance called lines of Zahn due to alternated layer of platelet and fibrin layer alternating with darker red cell rich layers. Such lines are significant in that they are the only found in thrombi that form in flowing blood. Their presence can therefore usually distinguish antemortem thrombosis. So the line of Zahn is an alternating layer of dark red and pale line characteristically occurred in thrombi formed during life. So its presence distinguish antemortem from post-mortem thrombi. This is the arterial thrombus, a gross photograph of a thrombus. This is the line of Zahn, dark red alternating with yellow or pale line. This is found in aortic aneurysm اللي بعدين راح تاخذوها بالمحاضرات القادمة, which is a localized dilatation in the arterial system. This is the line of Zahn. Mural thrombi that are anchored to the wall of the heart chamber. Vegetation thrombi in heart valve. هذه التسميات فقط. الترومبا هي نفسها نفس الكونستيتوينت نفس الترومباي, لكن إذا وجود الثرومباي بالهارت chamber called mural thrombi, ووجود الثرومباي بالهارت valve so thrombus called vegetation. Post-mortem thrombus, gelatinous and due to red cell subtle by gravity, have a dark red dependent portion and a yellow chicken fat upper portion. They are also usually not attached to the underlying vessel wall. هذه البوست-mortem هي after death by gravity. تأثير الجravity lead to the dark red portion lower portion, and yellow like chicken fat upper portion, and characteristically not attached to the underlying vessel. This is the heart, gross examination of the heart, and this is the mural thrombus اللي هي ثرومبس عادية فقط وجودها بالهارت called mural thrombus. Fate of a thrombus. Thrombi will undergo one of the following events: either propagation, the thrombi may accumulate more platelets and fibrin and finally obstruct the vessel. Thrombi are focally attached to the underlying vascular surface and tend to propagate toward the heart. Thus, arterial thrombi grow in a retrograde direction from the point of attachment, while venous thrombi extend in the direction of blood flow. Propagation معناها الثرومبس راح تكبر and accumulate more platelet and fibrin, then finally obstruct the vessels. Usually, direction of a propagation toward the heart. So, if the thrombus present in the arterial system, so they tend to propagate in a retrograde direction بعكس اتجاه blood flow، لأنه blood flow usually الارتري blood flow in the artery usually بعكس اتجاه الهارت، while in venous thrombi the propagation usually toward the heart, so in the same direction of blood flow. Embolization means detachment and circulate in the circulatory system at site and become lodged at site distant from the site of origin. Dissolution means disappearance اختفائها by fibrinolytic activity. Organization and recanalization. Organization means ingrowth of the digestion by macrophage and ingrowth of granulation tissue. This leads to the formation of a new canal that restore the blood flow and prevent obstruction. So the thrombus finally become recanalized and the blood flow will then return gradually to the affected site. This is the venous thrombi dissection, postmortem dissection. This is in the of the femoral vein. Opened, revealed large thrombus within the lumen. This is the gross picture, naked eye examination of thrombi. Mass, dark red mass. Thank you.